my name is Jake Klein. I'm a pediatric nurse practitioner with OKC Kids Urology. Today we're going to do a little educational video on assessing and identifying UTI risk factors. And what does that mean? UTIs are urinary tract infections, and we deal with that quite a bit across the board with our bladder and bowel dysfunction children. Even our neurogenic bladders have a lot of issues and can have some UTIs. And so when we visit with patients, I always explain UTIs very concisely so people can understand. Number one, with UTIs, there is no cure. And anytime you have a disease process with no cure, and obviously UTIs are not normal, but they happen, you're just looking at your risks, okay? You're trying to lower your risk factors. So take, for instance, if I had high blood pressure, family history is a risk factor. I can't change that, but I can change my diet, I can change my exercise, okay? So I have control over that. And when we talk about UTIs, there's basically two types. And so with urinary tract infections, you can have bladder infections, which are what we call simple cystitis. And your symptoms are going to be more mild. You can also have kidney infections, and that's what we call pyelonephritis. Okay, if you have a fence down the middle and you're looking at symptoms, well, over on this side of the fence, things are going to be mild. You may have fever, low-grade fever, you may have no fever, more irritative symptoms, burning, odor, those type of things. When you move over onto this side of the fence and you're having kidney infections, these children often get very sick. You can have lethargy, emesis, very high fever, pain and discomfort. Fever is the hallmark sign because it gets very elevated, and many of these children will wind up being admitted to the hospital for IV antibiotics. And so when we counsel our patients on urinary tract infections, we put focus on lowering the risk factors. And how do we do that? Well, if you tune into one of our other videos, we talk about bladder and bowel dysfunction, and we hit these four areas of time voiding, proper posture, voiding posture for boys and girls, proper genital hygiene for both boys and girls, and number four is the bowels. And so when we get all of these things working in harmony, timed voiding every 1.5 to 2 hours, great voiding posture, great genital hygiene, and excellent bowel habits with daily soft stools and good predictability, you're emptying the bladder well, that's the most important thing, is that you're going to have a very high chance of having resolution of your symptoms by just practicing these things. And so with urinary tract infections, they can present in many different ways. Babies are going to present with fever, and you always need to see your pediatrician when a baby has a fever so they can look from head to toe. If they're not able to find any source of the fever, they're often going to check for urine. And the best is going to be a catheterized sample with the baby. A lot of people will are not comfortable catheterizing young babies, and so they may put a bag on the baby to collect the urine. Those can be contaminated. Obviously, they're picking up bacteria that's on the child's perineal area, and they're not always very reliable. So there's a lot of different techniques: voided samples, catheterized samples, bag specimens, different ways to collect them. But the big thing with UTIs, you'll never get rid of them completely, but you can sure lower your risk by just having great bladder, bowel, and genital health. And so if you're having any problems with this and you can't get better on your own, look us up on the website. We're always glad to work with the kids that are having UTI problems. And again, my name's Jake Klein. I'm with OKC Kids Urology. Thanks for tuning in.